Welcome back, everyone. We are focusing on mental health this week in our series, Let's Talk Out Loud. And now we are going to take a closer look at a community-led initiative in Eskasoni First Nation, Nova Scotia. Take a look.
Growing up, I was always a part of Eskasoni Mental Health. I had a lot of loss in my life. I lost my father, my brother, my stepbrother, all within 2 years. So I accessed the services. For me, it kind of shaped who I am and where I am today because of that. If you think about it and you look back at the past, how much has happened in this community, the amounts of loss, the amounts of trauma with the residential schools, everything, at the 60 scoop. We've come so far.
Well, we just heard there from Bernadette Bernard, who is a client and now a youth worker at Eskasoni Mental Health Services. She joins us today with the organization's director, and that is Daphne Hutt-MacLeod. Welcome, both of you, to the show.
Thank you very much for having us.
Thank you.
Now, Eskasoni's population is just over 4,000, and your organization has provided mental health support to many of the community's Mi'kmaq people over the years. Daphne, what are the most common mental health issues that you're seeing?
So the most common mental health problems that we're seeing are anxiety, depression, relationship issues, addictions issues, lots of grief and bereavement. Just to give a little bit of context in terms of the community, we had a tsunami of suicides in 2009 that made national negative headline news. And following that, we decided that what we needed to do was amalgamate all of our services in the community under one roof. The whole community is our client, and we want to keep those in good mental health, while simultaneously providing services for those individuals who require more specialized care.
That's wonderful. Bernadette, to you now, like so many of the youth workers that are working there, you have such a personal experience with grief and with loss as well. What do you think that life experience does and contributes to your work there?
Well, by having your own experience and struggles, you become more empathetic. Here at Eskasoni Mental Health, you have the option to see someone will access services with someone who is non-Native and not from the community, or someone who is Native and is from the community. So you have that option to be able to tell your story from the beginning with someone you don't know, or just pick up where you left off with someone you do know, because they know your family, they know your history, they know who you are and where you come from.
And you're even able to connect when it comes to language, because Bernadette, you're actually one of the first Mi'kmaq-speaking interventionists in Nova Scotia. So what do you think that means for a Mi'kmaq child walking into your office?
Yes, I love that so much. It wasn't until I sat down with my first client and he was completely fluent in Mi'kmaq where I was like, wow, we have this real connection right here. We're both from this community. We both speak the language. We both know the language, love the language, and they're speaking Mi'kmaq to each other. And it's just absolutely amazing. And it makes me want to continue the work that I do and hope that it gives the children hope too, that look where I am today type of thing.
Daphne, you were telling us earlier that a lot of the efforts at your mental health center, they arose as a result, as you say, of the crises of suicides that happened in 2009. And you say that people who come from or are watching from outside of your community don't fully grasp how connected the reserves actually are. So talk to us a little bit about that.
Well, the Mi'kmaq Nation is across most of Atlantic Canada. And spreads into areas of Maine. And these are families that have been connected for generations through marriages, through deaths, through work initiatives. I don't know if people can appreciate how deep that wound is. And if someone passes away unexpectedly and the wound is deep in the community, in the family, but then it's a wound that's spread throughout the Atlantic provinces.
So at your facility, Daphne, you do provide services for both youth and for adults as well. But you say that the still enduring and stubborn stigma against receiving help for mental health services is particularly pronounced with men in particular. And so how are you trying to access the community and get around this stigma?
The group that we notice that aren't coming through the door as much as we would like are the ages 18 to 35-year-old males. And one of the initiatives that we started a couple of years back was gamer night, because we knew there was a high percentage of young men who were gaming alone at home and weren't necessarily going out and socializing, may not be going to school. And if they were going to school, they were being bullied. So we wrote a grant and were able to get high-speed internet in our youth facility and started gamer nights. And they're always filled to the brim. And we do educational components, and it's a way of them socializing. It's a way of getting them through the door, that important first step.
Now, Bernadette, as someone who both receives and provides mental health support in your community, what do you think non-Indigenous Canadians most commonly misunderstand when it comes to Indigenous mental health issues?
For me, I believe that it's intergenerational trauma, that sometimes people believe that it doesn't exist and it's a part of who we are today. I remember me and my mom sat down before and just going through like family history, and she said, we're very fortunate that both on my side and your dad's side didn't face the 60 scoop, the Indian Day School, or the residential schools until later this year, where we did discover that my dad was severely impacted by the Indian Day schools. And it was something like, wow, like, okay, this makes sense with the type of relationship that we had with my father growing up and how he raised us and how he wasn't very big on like seeking mental health services, but my mother was. So that says like a lot to where I am today.
It certainly does. We'd like to finish with a quick word from each of you. What is your greatest concern about the state of mental health in your community, and what is your greatest hope? Bernadette, let's start with you.
My biggest concern is always suicide when it comes to our community. A lot of the times in which I grew up with them, those who have died by suicide. And so what gives me hope is our youth space, our youth programs. That is definitely something that gives me hope and will continue to give me hope as long as we have the funding.
Well, I concur. I mean, the biggest hope that I have is the increasing number of youth that are coming through the door, but it's also my greatest concern. Because of the increased number of youth that are coming through our doors, what I'm worried about is what happens when our funding ceases to exist. We've been asked by government for decades to provide them with data. And they say they like to hear our stories, that they're heart-wrenching, that they're also inspirational, but they also want the data to back it up. And, you know, through a number of initiatives and partnerships, we have collected a wealth of data, both inspiring and gut-wrenching. And I get exasperated by the fact that despite all of this data, despite all of the stories, there has not been a measurable amount of change in terms of the funding within First Nations communities, specifically for mental health and addictions issues. And I guess my final word is, it's time to act. It's time to get things done. Let's have a can-do attitude.
And your passion is what we deeply appreciate, and hopefully that message gets to the right ears. And I want to deeply thank you on behalf of the show to you, Daphne and Bernadette, for joining us today and sharing these stories with us and our viewers.
Thank you.
Thank you.
And I do want to remind our viewers, if you'd like more information, we'd like you to head to eskasonimentalhealth.org. We'll put that up on the screen as well. We'll be right back after this.